Hi, my name's Nicola Rhind. I'm a specialist physiotherapist with the Pain Management Service in Grampian, and I'm the National Clinical Lead for chronic pain. Chronic pain affects between 1/3 and a half of adults in the UK, with 5% reporting severe disabling chronic pain in Scotland. We know that for a number of people, their chronic pain affects their mood, their function and movement, and significantly impacts their quality of life. Living with chronic pain can mean lasting changes to activities, routines and roles. And someone with chronic pain can feel low, exhausted and overwhelmed. They might find that family and friends don't understand and become frustrated. Living with chronic pain can lead to feelings of uncertainty about the future. Why self-manage? We know that many people living with chronic pain often have limited benefits from medications and sometimes limited benefit from other hospital treatments. Research and our experience of supporting people with chronic pain tells us that self-management is one of the things that can most improve the lives of people living with pain. And the Scottish Guidelines for Chronic Pain, which help patients and clinicians understand and discuss treatment options, called the SIGN Guidelines, list supportive self-management as a recommended intervention for chronic pain. Despite knowing that self-management is important, it can be difficult to put this into practice, and often help from community services, such as charities like Pain Association Scotland, and seeking support from health professionals is needed. However, people living with pain have told us that on the whole they feel that discussions about self-management come too late or not at all, and that often there's an increased tendency for medical solutions to be suggested. Pain Association Scotland provides specialist education, training and support in the self-management of chronic pain, enabling someone living with pain to engage in the principles of self-management and can support them to adopt a new way of managing their pain. We also know that despite considerable efforts across the last decade from local services and with national policy, that there remains great variation in access and provision of support to treat and manage chronic pain across Scotland. The Scottish Government are developing a new framework for chronic pain service delivery, and the aim of this is to improve access to care and deliver better health outcomes for people with chronic pain. A co-production approach was used to ensure people with lived experience and their families and carers are all at the centre of the creation of the framework. The framework focuses on the needs of people with chronic pain, and it's intended to improve support for chronic pain by a whole system approach. It builds on the principles and priorities outlined in the recovery framework for pain management services. It recognises priorities identified within the Scottish Access Collaborative report and the priorities highlighted by the Chronic Pain Lived Experience Group. Over the last year, the Scottish Government has brought together different groups who are determined to deliver improvements in chronic pain services, including people with lived experience, NHS representatives, health and social care partnerships, the third sector, academia and health professionals working in pain management. Together they've been involved over recent months in shaping of the new aim and priorities for the new framework. There are 5 aims underpinning the framework: improving how people with chronic pain move through the healthcare system, improving timely access to treatments, building a sustainable workforce, improving our understanding of the impact of chronic pain by collecting data, and ensuring best practice is delivered. A great amount of work has already been undertaken involving all of our stakeholders, and our shared vision is to ensure timely access to effective, safe and person-centred care and support that improves the quality of life and well-being of people living in Scotland with chronic pain.